Apabahuka. It can be correlated with a frozen shoulder. Word meaning of Apabahuka. The Apabahuka is mainly formed by two words, that is Apa and Bahuka. Apa here we can consider the dysfunctioning or stiffness or any separation, and Bahuka is the upper limb. Hence, Apabahuka is the term which is used mainly here, that the dysfunctioning of the upper limb or stiffness or any separation in the upper limb. Introduction. Apabahuka is one of the Vata nanatamja vyadhi, which is formed by Vata and kapha dosha. Apabahuka is one such a disease that hampers the day-to-day activity of an individual. Apabahuka manifests due to dhatu kshaya, and which is caused due to the sthana sanshraya of Vata dosha in the amsa sandhi, where there is a loss or dryness of shleshaka kapha from the shoulder joint. So it is mainly due to the sthana samshaya of vata dosha, as well as that the dhatu kshaya is also one of the cause for the manifestation of apabahuka. In sthana samshaya of vata dosha in the shoulder joint, which leads to the dryness of this shleshaka kapha from that shoulder joint, which leads to the stiffness and dysfunctioning of the shoulder joint. Nidana or causative factors which leads to the manifestation of apabahuka. So other than Samanya Vata Vyadhi Nidana, these are the specified Nidhanas which are responsible for the manifestation of the disease Apabahuka. First one is the Bahya hetu. So the external causes are any injury to the amsa sandhi. So is there any injury, or at the time of traveling, if the patient is excessive traveler, during the time of traveling, is there any there might be causes of any injury to that shoulder region, which will leads to the production of pain and stiffness over that reason. It might be one of the cause. Abhayantara hetu. Abhayantara hetu is mainly vataprakopakara. So if the patient is taking excessive vataprakopaka nidhanas, like by taking very ruksha and lagu kunatmaka aharas and excessive vyayama, excessive vyavaya, ratri jagarana, all these are the conditions where the patient is susceptible for the vata prakopa. Plavana. Plavana here consider it as that the excessive use of the shoulder joint or excessive use of the upper limb. So in case of the profession as a teacher and as a person, if they are doing or they are using excessive shoulder joints for their activities, then it might leads to the production of the disease apabahuka. And Bharavahana. If the person does excessive weightlifting, it also leads to the production. Balawat vigraha. Balawat vigraha means here that the person fights with a very strong person by their full of force, then it might also leads to the production of the disease. And Dukka kshaya, improper positioning or improper sleeping, improper sitting, improper staying position of the patient, because if the patient is sleeping with a high pillow, if the patient is sleeping with a high pillow, then there might be a chances of any obstruction, or we can say that there might be a pressure which will be applied over the region of nerves which are present in the cervical area. And if the person is not sleeping properly, then the nerves which are present in the nerves which are present in the upper arm, they might get compressed, and there might leads to the production of the pain. And if it will not manifest by 1 or 2 days. It is due to the continuous practice of these kind of activities which leads to the manifestation of the diseases. So Dukka kshaya here, the improper positioning, improper sitting, improper sleeping position of the patient, it is very much important here to understand. And marma abhigata, due to any injury, there might be a chances of hitting it into the marma point. That's why it is important to understand the nidhana. Apabahuka lakshana sirascha kunchaya tatrasyo janayetyeva bahukam. So the symptoms of avabahuka are bahu praspanditahara amshena santi shula stamba shosha. So it is mainly seen in the region of the shoulder joint. So bahu here is the upper limb or shoulder joint. We can consider praspandita, the normal functions of the shoulder joint. We can consider here that the normal functions of shoulder joints are like extension, flexion, hyperextension is also and also rotation, circumduction, abduction, adduction. All these are the normal functions which are responsible for all these are the normal functions which are helpful for the day-to-day activity of the individual. So there is a deformity or difficulty in these normal functions of the shoulder. Amshena santi shula, there is a presence of pain in the shoulder region. Stamba, stiffness which does the obstruction or difficulty or dysfunctioning in the normal activities of the patient, that is called as thamba. And shosha. Shosha here is due to emaciation. So as we have seen earlier that the main causative factor for the manifestation of Apabahuka is that the dhatu kshaya. So dhatu kshaya is also one of the main reason here, because the due to dhatu kshaya the vata get resided in the shoulder region or in the shoulder joint, we can say that. For that reason the vata does the shoshana of the shleshaka kapha which is present here. Shleshaka kapha can be correlated with the synovial fluid which is present in the shoulder joint, so it does the dryness of that synovial fluid, which hampers the normal day-to-day activity of an individual. So in modern it can be correlated with the frozen shoulder. So let's see what are the stages which are seen in case of the frozen shoulder. The stages of frozen shoulder are, it typically develops slowly and in 3 stages. Each stage can last for months. Freezing stage, shoulder movements causes pain. The ability to move the shoulder reduces. So the shoulder movement causes pain. First stage is the freezing stage where the shoulder movements causes pain and the ability to move the shoulder reduces. Second stage is the frozen stage. Pain may decrease but stiffness increases. Thawing stage, the range of motion in your shoulder begins to improve. Risk factors. And why it is essential to understand the risk factors, because we need to understand who are more susceptible to these kind of diseases. So first one is 40-year-old and older, particularly women. This is mainly seen in case of the person who is 40-year-older or 40-year-old or older than this, and it is mainly seen in case of women. Second one is people with prolonged immobility or reduced mobility due to rotator cuff injury, fractured arm, stroke after surgery. So the people who is not doing the regular or regular movement of their joints, or they are immobile, they are having immobility in their shoulder joints, that might lead to the production of this disease. Third one is people who have certain diseases appear more likely to develop frozen shoulder. Diseases that might increase the risk including diabetes, hyperactive thyroid, underactive thyroid, heart disorders, tuberculosis, etc. Chikitsa of Apabahuka. So mainly we are going to, other than the Vata vyadhi, Samanya Vata vyadhi Chikitsa, Kevala Vata Chikitsa is there, Samshruta Vata Chikitsa and Avrita Vata Chikitsa. So before understanding this, treatment for any vyadhi, the first line of treatment is Nidana Parivarjana followed by Samprapti Vigatana Meva Chikitsa. So in case of Kevala Vata Chikitsa, mainly Kevala Vata is involved. So the first and foremost causative factor for the manifestation of this disease is dhatu kshaya. So if the patient is associated with a dhatu kshaya due to vataprakopa, in that case we have to do the Kevala Vata Chikitsa. And Samshruta Vata Chikitsa can be done that the prakopita vata, which goes and subside in the area of shoulder joint, which leads to the shoshana of shleshaka kapha, that might leads to the stiffness and dysfunctioning in the shoulder joint. And in case of avrita vata, so the kapha does avrita to the vata, vata gets avrita by kapha. In that case we have to do the avrita vata chikitsa. How we can understand that it is avrita vata chikitsa? Because a patient can't tell you about the avrita vata is there or not. We can't understand by the saying of the patient. As a physician we need to understand by ourselves that in case of kevala vata chikitsa you are going to do the local application of snehana at that region. If it is a avrita vata, then the symptoms is not going to subside. The symptoms is further going to aggravated there. Here only we can understand that it is a kevala vata or it is a avrita vata. If it is kevala vata, it gets subsided by the application of snehana. If it is avrita vata, it is not going to subside by just application of snehana. It gets aggravated. So you have to give here the kapha vata hara chikitsa. So different acharyas have a different opinion regarding the chikitsa of Apabahuka. Acharya Charaka explained about Nasya and Uttara Bhaktika, Snehapana, Ashtanga Sangraha, Navana Nasya and Snehapana, Acharya Shushruta, Vatavyadhi Chakitsa except Siraveda. He accepted Siraveda in case of Apabahuka. Ashtanga Rudaya, Brahmanasya, Yogaratnakara, Bahu Parivartana. Bahu Parivartana can be considered here as the physiotherapy. The Shodhana Chikitsa in case of which is applicable, which is applied in case of Apabahuka is Snehana, Svedana, Nasya and Basti. Snehana can be done by any of the Vatahara Tailas, and Svedana by Patrapinda Sveda and by Nasya by using any Marsha Taila Nasya or any other, because it is a Udva Jatruka Vikara, it gets subsided by Nasya. Basti is Ardha Chikitsa in case of any of the Vata Vyadhis. So Basti is so, external Ayurvedic procedures are, these are mainly help to relieve pain and stiffness of joints and rejuvenates the degenerated connective tissues. So, mainly is Abhyanga. These all are the different types of Abhyanga or different types of massages which are helpful for relieving the Vata by using many Vatahara Tailas and Vatahara Dravyas. We are going to do these procedures. And Pichu, Shamana Ushadis, ವಿಷಗರ್ಭ ತೈಲ, ಮಹಾನಾರಾಯಣ ತೈಲ, ಧನ್ವಂತರಿ ತೈಲ, ಕೊಟ್ಟಮುಚ್ಚಕಾದಿ ತೈಲ, ಬಲಾ ತೈಲ, ಪ್ರಸಾರಾಣ್ಯಾದಿ ತೈಲ, ಯೋಗರಾಜ ಗುಗುಳು, ರಾಸ್ನ ಎರಡಾದಿ ಕಷಾಯ, ಶಿಲಾಜಿತು ವಟಿ, ಪ್ರಸಾರಾಣಾದಿ ಕಷಾಯ, ಸಹಚರಾದಿ ಕಷಾಯ, ಮಹಾರಾಸ್ನಾದಿ ಕಷಾಯ, ದಶಮೂಲಾರಿಷ್ಟ, ವಾತ ವಿದ್ವಂಸರಸ, ಮಹಾವಾತ ವಿದ್ವಂಸರಸ, ವಿಷಮುಷ್ಟಿ ವಟಿ. Agnikarma in Apabahuka. So it should be done over the region of shoulder joint.